webinar in just a second to get all of those links going.
All right, let me just share this Zoom slide now.
Julie, you can go off camera until we go live.
Good afternoon and welcome. I'm Dr. Jamila Taylor, Director of Healthcare Reform and Senior Fellow at the Century Foundation. For those of you who may not know us yet, TCF is a progressive, independent think tank that conducts research, develops solutions, and drives policy change to make people's lives better. We pursue economic, racial, gender, and disability equity in education, healthcare, and work. My team at TCF, the healthcare team, is deeply engaged in work focused on health equity and reproductive justice, both of which were threatened by last week's devastating decision by the Supreme Court. Abortion care is essential health care for women and anyone who can become pregnant. The consequences of the court's decision to overturn Roe versus Wade will have disastrous implications for people across the country. Marginalized people, particularly Black and Brown women, and those with lower incomes who already faced disproportionate barriers to accessing abortion care, even with Roe in place, will be the most impacted. The past few days have been disheartening to say the least, but there is still hope for safeguarding reproductive rights and preventing the very worst possibilities from becoming a reality. Today, TCF is excited to bring together a panel of experts with extensive policy and political experience to help make sense of the ruling and discuss where we can go from here to protect reproductive freedom for all. My colleagues have spent decades in the fields of healthcare, economic and disability justice, education, and they all bring a diversity of viewpoints to this critical conversation and important perspectives on access to abortion care. Before we get started, a few housekeeping items. First, please note that the event is being recorded and live streamed. If you'd like to submit a question for our panelists, press the Q&A button at the bottom of your screen and type away. Now let's get started. To begin, I want to welcome our esteemed panelists, and I'll also preface this by saying these are also some of my favorite people at the Century Foundation. First, we have Anna Bernstein, TCF Healthcare Policy Fellow. Then we have Stephanie Hall, TCF Higher Education Policy Senior Fellow. Julie Cashin, TCF Director of Women's Economic Justice and Senior Fellow. And last, but certainly not least, Kimberly Maxted, TCF Co-Director of the Disability Economic Justice Collaborative and Senior Fellow. So to get things started, I want to talk about last Friday and sort of where we all were in the midst of the decision and what our initial reactions are. So for all of you, can you tell me where you were when you first heard the news and what were your initial reactions? Why don't we start with Anna?
Thanks, Jamila. This is Anna speaking. It's great to be here with you all today. And, I think we all knew this was coming. Last Friday, I was actually at an appointment. I mean, as much as I tried to schedule around SCOTUS decision days, it's not always possible. And as much as we knew this was coming even before the leak, but particularly since the draft decision was leaked in May, I think it's something different to see it actually come down. And it was a little bit surreal to see that Roe v. Wade was actually overturned, even knowing that this was coming and knowing that this was instantly having implications across the country.
And then why don't we go with Julie next?
Thank you, and thanks so much for leading this effort and so much of this work for so long, Jamila. I was in our staff meeting with the Century Foundation, and I think a bunch of us were reacting at the same time and sort of slowly absorbing it. And, whether for me, it was a combination of anger and sadness and numbness. In May, when we heard about the leak decision, that night, I needed to be out in the streets with others and went right into the New York City rallies. And that felt like the right place to be. On Friday, I needed to just be on my couch and just feel kind of the weight of it in that way.
Great, thank you, Julie. Kim?
Yeah, and similar to Julie and others, I was in our staff meeting. It was quite a moment to kind of react together. I think we were all maybe half paying attention to the staff meeting as we were, quickly updating like SCOTUS blog and others, and waiting. I think many of us knew that the last Friday in June was probably when the decision was coming, and similar to what Anna said, like, even though we knew it was coming, we'd seen the leak decision, I don't think it made it any easier in that moment to like actually, see it on paper. As a person with chronic illnesses, I kind of fight for healthcare access and what I need on a really constant basis. But that's so different than in an instant having like a fundamental right stripped away and kind of feeling that. I agree with Julie. Like there was just a weight of it. You just like felt it, and it was very like visceral. So it was quite a day.
Thanks, Kim. Stephanie?
Yeah, and with my colleagues here, I was sick to my stomach. To be honest, I had dreaded the ruling coming down, and I do sit with a lot of worry that, excuse me, our economy and our society is structured in a way that like large scale mobilization that could be useful right now is really difficult. A lot of folks are being crushed by student debt, inflation, flat wages. So if it's a struggle to survive day to day, anyone who wants to oppress a certain group, they have the upper hand then. And to me, that's what this ruling really drove home. I wouldn't be here though if I weren't optimistic. So I have been keeping in mind our friends in the South, in Latin America. They have had some major wins, expanding rights for women there in the past couple of years, even in the face of pandemic and economic recession. So I'm clinging to those stories right now to keep my optimism.
I'm with you, Stephanie. I mean, I was actually supposed to be off that day for a vacation day, and needless to say, that did not happen because, I was sitting on my couch and, started to see the news come down. My mother actually was the first person to text me. And I remember her text being, Roe v. Wade, wow. And so I jumped up and started to check email and all of the news alerts on the issue. And, while the initial sort of feelings were anger and sadness, I must say that seeing the thousands of folks, gather at the Supreme Court so quickly, and really across the country, it wasn't just, here in Washington at the Supreme Court, all over the country, people were organizing and marching and protesting against this. And to me, I continue to be encouraged, particularly by the strength of women in this moment, who are not by any means backing down to make sure that these rights are restored. So thank you all so much for your candid responses to that question. Next, why don't we have Anna give us an overview of the decision and what it means for reproductive rights and abortion access nationally.
Sure, thanks. And I'm sure this is not news to many of you, but the decision, of course, did explicitly overturn Roe v. Wade and Casey, eliminating the federal right to abortion. So immediately states, some trigger laws went into effect, meaning abortion was banned entirely or almost entirely. Other bans that were not total bans, but are still limiting access are in effect. And I just want to emphasize that this is really causing chaos at the state level. I mean, fortunately, some states have been granted temporary restraining orders, but it means that this legality is really in flux. And this is obviously causing confusion for people on the ground, and for abortion patients, this is, they need their care in a timely manner. And this is a real issue that's impacting them in real time. And so we know that some people will travel, but the distance to travel to a clinic is only going to increase. This is going to be hundreds of miles for some patients, because we know that gerrymandered and oppressed areas like the South are the places losing access, the South and the Midwest. So folks that are able to travel are incurring huge costs, transportation, childcare, because we know most folks seeking abortion are parents already. and time off of work, which, I'm sure Julie will touch on. We don't have a guaranteed to paid leave, but that's assuming folks will travel. And of course, not everyone can overcome those burdens. And, as Jamila said, we know under Roe, this was not enough. Folks that were being hit hardest are people struggling to make ends meet, people of color, immigrants, young people. And this is just going to really exacerbate that and amplify those effects.
Thank you, Anna. As a follow-up to that, can you talk a little bit more? You mentioned that, there are some people that, will be traveling to other states where, that have chosen to, not only maintain access and right to abortion, but even some states are even expanding, abortion rights and access in this moment. Can you talk a little bit more about, maybe give us a preview of what some of those states are in terms of those expansions, and what they're doing to welcome, folks from across the country, really, who may be in desperate need of abortion care if they're living in a state that has completely decided to completely, make abortion inaccessible to folks in their state.
Yeah, so we've seen states like California move forward with laws that are meant to not only expand access and have access available for their residents and out-of-state residents, but also protect providers, patients from laws in other states. We've seen places like Missouri try to push forward laws that would criminalize traveling to other states. So there's really a number of ways that that states are trying to safeguard access, and a lot of that is the legal implications. But I think it's really important to note that even states that we see as states that are super friendly to abortion, they can't meet the need of all folks seeking abortion care, even if everyone were able to travel. And we have practical support networks and abortion funds that are doing heroic work, funding patients and getting them to travel. But these clinics cannot see the influx of patients that they would need to make sure everyone gets the abortion care that they need. And I think we do have to acknowledge that even folks in friendly states are going to be affected by this, whether it's the wait time for care, which we know they need in a timely manner, or just simply not being able to meet the needs of all the patients that need care.
Absolutely. And I think even the decision to, if you can travel, that has implications for our pocketbooks, right? And some companies have even stepped up to the plate and said, they will offer travel vouchers for their employees who need to travel to get abortions across state lines. I think we saw, updates from Dick's Sporting Goods. I think Netflix is also a company that has announced this. And so we are seeing the private sector sort of step in to fill the gaps here. But even still, it's going to be a challenge for folks that don't work for these organizations and they don't have the privilege of having access to those travel vouchers. And we also know, because so many families in this country are living paycheck to paycheck or don't even have the savings available for a typical emergency, that something like this is really going to be a strain on them. And so with that, I want to shift to Julie. Evidence suggests that states with the strictest abortion laws also have low rates of pay equity. They lack paid family leave. They don't offer families access to affordable childcare. Economists also agree that the fall of Roe will impact women's earning potential, their labor participation, and a whole host of other economic implications. So Julie, can you talk about how the Supreme Court decision is going to disenfranchise working women and their families?
Yes, and what you said is exactly right, that there's this direct connection between the ability to plan and decide when, how, and under what circumstances you have a family, and economic security and economic stability. And if you think about the ways in which women, and especially mothers, have been holding the weight of the world on their shoulders, especially during the pandemic, but even before that, right? They're doing, managing work, they're managing care, they're managing health. And they're doing it, without public investment, without resources of, community, even especially during these moments of isolation in the pandemic. And now, on top of that, it's that visceral pain of somebody else trying to control pregnancy, along with those realities of the economic consequences of abortion bans. And so, it's a combination of common sense and in-depth research that shows that this really makes a difference. And if you think about it, the United States does not have a care infrastructure in place. We have no comprehensive child care and early education system. We have no paid family and medical leave nationally. We have no paid sick days laws that let you care for yourself and your loved ones. We have no supports for people with disabilities and our aging loved ones either. No pregnant worker fairness requirements. So there's this litany of national policies that we know we have been fighting for decades, we know would make a difference, we know would make it easier to work and care. And yet the United States has never invested in those things. And so now we're going to add on to this, taking away the freedom of bodily autonomy, taking away the freedom to decide when and how to start your family. And that's just going to have harsh consequences. It is expensive to raise a child, and not having support, not having public investment to, to look at all of these pieces, to invest in care is really challenging. And we need all of these things, right? It's not that we just need a care infrastructure and then abortion bans would be just fine. Like, that is absolutely not the case, right? We need to have, the bodily autonomy. We need to protect the right to access abortion, and we need to have a care infrastructure in place. If you want to invest in babies, we know there are so many ways to do it. This is not that. This is a power grab that will absolutely widen gender, racial, and economic equality.
Thank you so much, Julie. And as a response to that, I actually want to unpack some of the proposals that we're actually seeing come out from, these pro-family, pro-life members of Congress. Senator Marco Rubio, for example, has released a plan that supports expanding the child tax credit, pouring more funding into the WIC program, Women's, Infants, and Children, having more supports in place to ensure that moms can get the child support that they need, promoting marriage. So what is your response to that? I mean, if you look at, sort of what you presented in terms of the care infrastructure and some of the challenges, particularly moms face in terms of, parenting the children that they have and supporting their families, one may look at this pro-family plan and say, well, look, this is the answer to these problems. And so, Julie, how would you respond to that in this moment?
I think that we know what the policies are that we need, and that they are protect access to abortion, invest in comprehensive child care and early education, invest in paid family and medical leave, pregnant worker fairness, flexibility for work scheduling, paid sick days, right? These are the policies that we need. The child tax credit, right? The policies that were part of the American Rescue Plan really made a huge difference in helping people to get out of poverty. We need to extend that. I think that anyone who's putting up these pro-family policies right now and also supports the abortion bans is really someone we should look at with a lot of skepticism, because where have they been in supporting parents? Where have they been in supporting babies? Where have they been in supporting women's ability to work and have a family and support themselves and get ahead and achieve equity, right? I mean, they have not been there. And so anything that they're proposing, I just think needs a lot of skeptical eyes on it.
Yeah, absolutely. And I think, look, all of us here, participating in this conversation, we support women and we support families, and we also support choice, right? And so even if we were able to secure all of the things that are included in Senator Rubio's plan, we still need abortion rights. There are still going to be people that are not ready to become parents, and they should have access to the healthcare they need. So thank you so much for that, Julie. Another important, I think, population or community in the context of this conversation are college students. We know that legal access to abortion increases a woman's probability of graduating from college by 42%. Women make up nearly 60% of all US college students, and we know that they rely on their university for access to vital healthcare services, everything from counseling on where to get a safe abortion, as well as other sexual and reproductive healthcare services. So Stephanie, I want to go to you now. How will this decision to overturn Roe versus Wade impact women in college who find themselves pregnant and without access to the abortions that they need?
Thanks for that, Jamila. This is Stephanie speaking. Julie mentioned a lack of a care infrastructure, and I think that is a really great way to describe the infrastructure that's present on the campuses that most college students attend. So in this case, I'm thinking of, the large proportion of college students in the US are attending community colleges, and community colleges suffer from a lack of resources and a lack of funding. Add to that bans to essential healthcare, bans to access essential healthcare. And I think what's going to happen is we will see a whole lot of folks have their plans derailed, and that's going to have impacts for multiple generations. Childcare responsibilities are more likely to interrupt the college plans of low-income students than their wealthier peers. That is going to have a ripple effect in our economy. So the ruling and the coming actions from some of the states, this makes it a really dangerous time to be a student seeking abortion care. It's already having a chilling effect on providers who are afraid of running afoul of their particular state's laws. I think it's going to have a chilling effect on speech on campuses. And college students are really going to need their schools to safeguard their personal information. They're going to need to create a safe haven from any criminal or surveillance systems that are going to be put in place because of bans. The one bright spot of last week is that the Biden administration released its proposed Title IX rules that could provide some leeway for colleges to do those things. So it will provide, accommodations for students experiencing pregnancy or miscarriage or abortion. And it would also give easier access to those accommodations. So really the hard work at protecting college students is going to be placed on university health centers, but it's important to keep in mind that not all students attend schools with a healthcare infrastructure. So directives for students to just go to college somewhere else is really out of the question. It's really elitist. There is a myth of broad college choice in this country. It's very pervasive, but most college students go to a school within a couple of hours drive of their hometown. And so students in states that already have these bans in place are going to be harmed. They don't have other options. And going back to the the idea of the typical college student, almost half of all college students are over the age of 25. They already have children and caretaking responsibilities outside of the classroom, on top of holding down at least one job. That situation isn't ideal to start with, but it was indicative of this national push to increase college access and college completion. So though it's a struggle for those students, it was indicative of some gains that we made in education in the US. I think the impact of this ban, we're going to see a whole lot of those gains lost without some sort of intervention.
I agree. And as a follow-up, Stephanie, I mean, one of the things that keeps coming up in my mind, particularly as I think about college students, is whether or not this decision is going to impact the choices of rising college students, right? Whether they decide to, pursue their college careers in states that have decided to ban abortion in this current moment. And just wanted to know if you had any sort of thoughts or perspective on that.
Yeah, and you know what? I was mentioning how the idea of college choice in a lot of our minds is different from the reality from the vast majority of 18 to 24-year-olds looking at college options. But it is true too that, colleges do rely on out-of-state and international students as a really lucrative source of revenue. So if those students are able to vote with their wallets and go elsewhere where they feel safer, I think we'll see some downstream effects on resources available on campuses. So not only will this, it's definitely going to have an impact on students, but it's going to have an impact on colleges' bottom lines to some degree. Yeah.
Wow, thank you for that. And now I'm going to shift things to Kim. Kim, we've talked and written about how this decision will hurt marginalized communities the most, namely women of color and low-income people. However, I think as advocates, we haven't done nearly enough to uplift the impact of this decision or really just access to abortion overall when it comes to people with disabilities. What are the implications for overturning Roe versus Wade for people with disabilities? And in your answer, would love for you to make the connection between disability rights and reproductive rights.
Yeah, absolutely. And this is Kim. And first, it's really great to be in conversation with everyone today. And I think I kind of want to start by just noting that really every issue we've talked about is a disability issue. I think that's really the frame we take at TCF, and that's true of reproductive rights too. It is a disability issue, and it impacts all disabled Americans, all people with disabilities. And so I think that's really important. So while unfortunately not all advocates, as you mentioned, really think about reproductive rights impacting people with disabilities, it absolutely is part of really the disability rights, disability justice movement. So overturning Roe has all the same negative implications that my colleagues have mentioned here already. But for some disabled individuals, pregnancy can actually be life-threatening. And so access to abortion is absolutely critical. So some people with disabilities are actually at a heightened risk for complications during pregnancy, and abortion is really a life-saving measure. In addition, reproductive health care is really, really difficult to obtain for people with disabilities and for women with disabilities. Limiting that access by closing clinics and really restrict all the restrictions that I know Anna really went into, where the implications of this decision is really going to exacerbate the inequities that we already see in many states and really across the country. So women with disabilities have really high rates of cervical cancer due to lack of preventative care and preventative screenings. We also see, this is often because we have clinics that are inaccessible and really doctors lack training. And so even traveling to clinics pre this decision, traveling to clinics within states was often really difficult because we have inaccessible transportation, but even the closest clinic may not have been accessible. So now if we see these clinics closing down, if we see care limited, just traveling to the next state that's available and the closest clinic is not necessarily an option for disabled women and just all people with disabilities that may need this care. So it's just even going to be harder. So it's not just simply limiting abortion, it's actually limiting all the reproductive care that goes with it. And also really overturning Roe makes clear the lack of bodily autonomy that really women and people with disabilities who can become pregnant have in this country. So disabled individuals know about kind of lack of bodily autonomy all too well, unfortunately. Reproductive justice and disability justice both center on bodily autonomy and really individual choice. And so many disabled people have to constantly negotiate their rights to their own choices, in particular over their own bodies. And it's really a sad kind of truth about where our society is at and ableism and how rooted that is in so many of our choices about healthcare. But overturning Roe just underscores the lack of choices that disabled people and others have on their reproductive care and really limits decisions for, fully engaging and actually equitable care in this country. I think it's also important to note that we often see really harmful rhetoric regarding abortions and disability, really with reason bans, which were the root of some of these states and a lot of their laws. So reason bans often say that they're being used to prevent discrimination against people with disabilities, when at their core, they actually sort of pit the disability community against the reproductive justice and reproductive care communities. So they often actually undermine the goals of bodily autonomy and choice, which again are central to the disability community. And they're not actually about preventing discrimination. They're again about control, and as I think Julie said so well, and they really are actually about limiting choices for people who are pregnant to actually seek appropriate medical information, and they really perpetuate misinformation about disability. So reason bans are often used to sort of manipulate the community and can be really problematic. So those are just a few of the pieces that I think are really important. And again, that intersection on bodily autonomy is just really critical when you're thinking about reproductive justice and disability justice.
No, thank you so much, Kim. And I appreciate you for sort of giving us that well-rounded overview of, both, I think, the intersection of disability justice and reproductive justice. And then also you really pulled out some of the, I think, challenges that people with disabilities may be experiencing when they are pregnant. And one of the things that came up for me, which is closely connected to this, is also this country's maternal mortality crisis. And so, for those of you that are participating today, you're probably aware that, the United States is in the midst of a maternal mortality crisis where, Black women are about 3 times more likely to die of pregnancy-related causes when compared to white women. And we certainly know that these are the same populations that are also going to be disproportionately impacted by any restrictions or outright bans on abortion. And so having Roe v. Wade overturned is certainly going to do nothing to help us better our situation around maternal health in this country. It could actually make the issue very, very bad or much worse than it currently is. So thank you so much, Kim, for bringing a broader view into the conversation. So now that we have talked about all of the challenges, when it comes to this issue, and I think also centered the work that we all do individually, but obviously in this moment, thinking about it in an intersectional way, really across policy teams at TCF. I'd like to start talking about, what we're seeing as some of the opportunities in this moment. I feel like the conversations nationally have been very much focused on, I think, not only what states can be doing, but also what can be happening at the federal level, both with Congress and the administration. So why don't we start with Congress? I want to go to Anna and then Kim and have you all talk about, what Congress can do in this moment to actually expand abortion rights and ensure access. Anna, let's start with you.
Thanks, Jamila. Yeah, so we know that Congress already has a bill in its pocket that would do more than set the standard that we had under Roe, which we know was not enough to guarantee actual access. The Women's Health Protection Act, WIPA, passed the House, did not pass the Senate, but we know that it would create a statutory right to abortion care, and it would go beyond the standards set by Roe, in which folks didn't have access to care in so many cases. And I think another piece of this is the affordability. In addition to being able to access care, can folks afford it? You mentioned a lot of Americans don't have the money for emergency expenses, and abortion care, is a median price of over $500 for that care just to begin with, not even to mention the ancillary expenses that come with things like travel and time off work. And insurance coverage for abortion is so limited by things like the Hyde Amendment and other riders. So Congress can pass budgets like the House has done without the Hyde Amendment and other restrictions on abortion care that really just discriminate against low-income folks and other people who receive either their health care or their coverage through the federal government. So that's things like federal Medicaid funds, Medicare, the Indian Health Service, and Peace Corps. Just, it's really wide reaching. And the EACH Act, which has also passed the House, would undo these bans and really make abortion more accessible for folks that receive their coverage through the federal government and stop the federal government from interfering in private insurance coverage of abortion in places like the marketplace set up under the ACA. So I think we really need to come at those two angles of accessibility and affordability and just sort of take this as a moment to envision what can we do to set up a standard that goes beyond Roe and actually creates real accessible access for the folks that need it most.
Great, thank you, Anna. Kim, anything to add?
Yeah, well, first, second, everything Anna said. So great. I'm just going to add two additional pieces. So I think first, in addition to kind of the accessibility and affordability, I think we also have to think about the fact that we still have another SCOTUS decision that is actually some of the legal precedent around forced sterilization. And so that's the 1927 decision, Buck v. Bell. So I think that's often not talked about. We have about 31 states that actually permit the forced sterilization of people with disabilities. That is, I think, shocking for so many and often unknown. The National Women's Law Center actually has a fantastic report from last year kind of delving into this. This is really something that I think we need to confront, we need to talk about, and we need to have a serious conversation about how to fix this, because we really can't even get into abortion access if we're sterilizing people, very early on or at any point in their lives. So I think what can Congress do? They can take action on this. And I think it's something that needs to be done sooner than later. If we're going to talk about bodily autonomy, forced sterilization has to be a part of the conversation. And so the other piece of this I'd just like to add is I think Congress also needs to ensure that reproductive health care is actually accessible. So as I mentioned, some of those pieces that we discussed before about training of doctors, training of nurses, really making sure clinics are accessible. These are pieces that Congress can take action on and really should. And I think those two pieces together really can help kind of take everything to the next level.
Great, thank you so much, Kim. And before we get to our last question for the panel, before we transition to audience questions, I do just want to offer a shameless plug that Anna and I actually published a piece earlier this week that centers on 5 actions the Biden administration can take in this moment. Anna mentioned the issues around insurance coverage of abortion, and so we're calling on the administration to ensure that abortion coverage, to the fullest extent allowed, considering the current legal confines, that abortion coverage is accessible to all, and that the administration reiterate that to the states, particularly through the Medicaid program, as well as through private insurance. We're also calling for declaring a public health emergency, similar to what we have done during the COVID-19 pandemic. And here we see this as an opportunity to ensure that, abortion access, funds are freed up, and looking at programs like Medicaid, having some additional flexibility there to support people in this moment that cannot access abortions where they live. But there are a whole host of things in that document, and we will share it in the chat and also make sure that we lift it up on Twitter. So I encourage our participants to look at that. And then just also wanted to plug too that, the administration also has a website. It's reproductiverights.gov. And there folks can get information on, access to contraception, even, abortion access in this moment. And then we also heard earlier that OPM has released a guidance for how federal employees can use their sick time to, access abortion care. And this will be included for using FMLA for travel if necessary. So the administration is starting to think more about this. I think another important piece for us is making sure that information about abortion is truthful and evidence-based and available to all people. And then, also too, we want to see the president use the word abortion in his public statements, both written and verbal. So why don't we, get into, right before we get into audience questions, I did have one more question for the panelists, And just wanted to ask you all, how can people channel their anger in this moment and engage for the fight for abortion rights? And so why don't we have like quick responses, like rapid fire from all of you. Let's start with Stephanie.
So first, I'd say, support your local abortion care networks in any way you can, including through direct action if possible.
Thanks, Stephanie. Anna.
Yeah, I would just encourage folks to plug into the network and the infrastructure that already exists. Abortion funds have been doing this work for a long time, practical support networks. Just donating, setting up recurring donations to your local abortion funds is a great way to start.
Great. Julie.
This is big. It feels painful. It feels enraging. So I think there's engage in the fight and also take time for joy, take time for you, right? I mean, we need to make sure that we are doing our best to invest in our community, to have compassion for each other, to care for each other. So I think really focus on those connections, that compassion, that community as part of all of the rest of this as well.
Great. And last but not least, Kim.
I would say if you're comfortable, tell your story and work with others. Just as the reproductive justice and disability justice communities coming together have a more powerful message, you can make your message more powerful by really coordinating and making your voice more inclusive and more powerful that way.
Great. Thank you all so much. So now why don't we shift to audience questions? The first one here, I want to give this one to Anna. And this question is, what can the FDA do to increase access to mifepristone and make birth control available without a prescription?
Yeah, so the FDA is currently going through the process of finalizing the restrictions on mifepristone, which is one half of the commonly used regimen for medication abortion care. So, they are going through their process, reviewing the evidence and finalizing that now that they've removed some of the restrictions that have been in place, given that the drug is so safe and effective, really safer than Tylenol, but very hard to come by. So, there is a role for the administration to increase access to mifepristone. And I think especially is just the information piece and making sure folks have information about medication abortion care available. And, Congress has also made moves to make birth control available over the counter, which we know it's one of the most widely studied drugs and really can be safely prescribed, can be delivered without a prescription. Folks are more than capable of knowing their own contraindications and whether they can use birth control or not.
Can I just throw in too, that's a wonderful opening for, college campus-based healthcare services to be one of those access points. And, colleges, well-resourced colleges with really elaborate healthcare infrastructure should be sharing the wealth. They should be forming networks with lesser resource schools to make sure that we have at least a smidge of equity in distribution here.
And some states like California and Massachusetts actually have medication abortion care available in their campus health centers. Obviously, not every school has health centers, as Steph said, but that's a really important way for states that have that political will to make it available to students who might not be able to travel off campus for care.
That's true. And as a follow-up to that, Anna, can you, I think we've been seeing, a lot of conversation largely on social media, or at least that's where I've seen it, about abortion pills by mail and whether or not that is allowable or legal. Can you talk about that a little bit?
Yeah, so there's different ways to receive medication abortion, whether that's directly through a clinic, in person, telehealth with a clinic. That depends heavily on state laws. I think it's 17 states that have banned telehealth for medication abortion care purely for political reasons. We know that it's incredibly safe and, folks don't need to travel in person to pick up pills from a healthcare provider. But there's also, outside of the formal healthcare system, there are organizations that distribute mifepristone. And this has been going on in the international context for much longer. It's really been well researched that folks can take medication abortion pills safely, even if they're going outside of the formal healthcare system. And I think it's just really important that folks understand that even though the pills themselves are very safe, mifepristone and misoprostol, the risk is going to be more legal, especially now that Roe has been overturned. Folks are going to be criminalized for their pregnancy outcomes. We've already seen this happen. We see it happen most with Black and brown women and people who can become pregnant. And there's groups like If, When, How who have a legal defense fund and do a lot of education about this. So I think just being aware of your legal risks and having guidance from the government that healthcare providers do not need to report if they suspect that a patient has self-induced an abortion, and just understanding that criminalization does not belong in healthcare at all.
Absolutely. And I think, Anna, you made an important point that, any sort of efforts to criminalize people, who may be undergoing miscarriage, or maybe showing up to hospitals after completing an abortion with pills, Black and brown people will be most heavily impacted by those efforts. We have a question here, asking about, how this ruling could disproportionately impact Black women. And, I think not only the issues around criminalization, which, we've just talked about, but also, I mentioned the Black maternal health crisis earlier in the program. And so I think, having abortion banned will certainly have implications for worsening our Black maternal health crisis in this country. I think also another piece of this is the fact that, due to longstanding racism in the healthcare system, and the fact that Black women are least likely to have access to the healthcare services they need. In some instances, they're less likely to have access to the insurance coverage that they need, and they experience a whole host of barriers when it comes to accessing healthcare. Abortion care is no different, and so this is part of the reason why we tend to center Black women and other women of color in these conversations, because they are the most disenfranchised when it comes to our healthcare system, and in turn will be the most heavily impacted by these bans on abortion care. So another thing I wanted to bring into the conversation is, there's a question here from the audience about voting, right? And whereas we recognize the importance of voting and participation in the electoral process, I also think we can understand that some people may feel bewildered about voting right now, and may even feel like, does my vote even matter in this moment? And just wanted to see if you all had a response to that piece, for anyone who may be listening, and they may be questioning whether or not it even makes sense to vote, because they're so disheartened by, what they're seeing, not only in terms of the Roe decision at the Supreme Court, but a whole host of these other decisions, what's happening in this country, a lack of response on gun violence, police brutality, a whole host of other social justice issues. And so how would you all respond to that? Why don't we start with Julie?
I would say that there is an authoritarian minority who is promoting and spreading inequality and violence, and really trying very actively to disenfranchise people, to hold on to their power with their, nails. It's like they're just like grasping to hold power no matter what. And the choice that we have is to look and say, well, what do we want? We are the people. We want a government that represents us, that looks like us, that, really is of the people, for the people. And the best way to engage in that is to vote and to, have your voice not silenced, right? There's an effort to try to divide us. There's an effort to try to make you feel hopeless, make you feel like what you have to say and what you think does not matter. And so the worst thing you can do is give up and stay home. The worst thing you can do is kind of let those voices win. And so on the one hand, democracy is at risk right now, and there's so much work to do. And on the other, the way to do it is to stand up, to use your voice, to use your vote, to, be a part of the conversation.
Anyone else want to chime in on that one?
Sure.
Go ahead, Kim.
I'll jump in. I think Julie said a lot of things very, very well there. So won't repeat anything, but I think it's also really important once you voted to continue engaging and telling your story. And, one of the most powerful things that you can do is share why these issues matter to you. It's really important to be clear about why this is important, why it's impacting you. And I think, again, yes, you're one voice, but when I think many of us said it was so powerful to see folks gather in when this decision came out. That's because there's a collective response and, feelings when this is all happening. And one voice then becomes a collective of voices that can be incredibly powerful. And so it's important to continue that engagement and continue sharing. And stories with paired with the evidence really become the thing. Sorry, that's my light. Really become the thing that makes the change. And so at the end of the day, I think continuing that and knowing that your voice and your personal experience is really what can make a difference.
Great. Thank you so much, Kim. I think an important point that you made too is like what you do after the vote, like yes, vote, but then there's the part after that. And, when we elect people to represent us, they work for us. And so there's nothing keeping you from writing letters or calling up your representatives and being clear about how important these issues are to you and how you'd like them to respond to them. So next, let's go to Stephanie.
Yeah, I just wanted to add, voting, getting in touch with your reps, crucial things you can do, but really figure out who is in power, get in touch and stay in touch with them. And specifically for college students, college faculty, college staff, that means engaging with university and college leadership and their governing boards. So get on the record with your perspective, your needs, and encourage your friends to do the same. If you possess an excess of social capital or privilege, we might call it, it's even more important for you to do that. We need to step up and do this for our friends who are more likely to be criminalized by the system.
Absolutely. Anna, anything to add?
Yeah, just echo everything my colleagues have said. I would say, pay attention to state and local elections. Obviously, that's where so much of this fight has been. There's groups, especially reproductive justice groups, that have been leading this fight on the ground, just following their lead. And, recognizing that voting is part of the solution. It's not all of it. And a lot of the places that are hit hardest by abortion restrictions are also hit hardest by gerrymandering and or have their voting rights really limited. So understanding that it's part of it, but it's really, it's not the complete solution. We have to address whether the folks that are impacted are able to exercise that right.
Absolutely. And I think also too, again, giving a shout out to folks that are protesting and organizing across the country in this moment. Thank you so much. And we're all here together in solidarity on this issue. And, this is something that the Century Foundation will continue to cover and work hard on, as we move forward. We will not stop. So thank you so much to all of you for participating today. As I mentioned earlier, these are some of my favorite people at the Century Foundation, and they have taken time out of their busy schedules to be here today and talk about, this important issue. And I also want to thank those of you who are participating in the event today. And be sure to continue to keep up with the work that TCF is doing, not only in abortion access, but across a whole host of other policy issues. A recording of this event will also be available on our website at tcf.org. Thank you all so much.